Good afternoon, everyone. Thank you for joining us today for our Dentistry and MD webinar. We are very lucky to have Dr. Jean Casagrande as our presenter. Dr. Casagrande will speak today about MD and dentistry. He will go over the safety precautions necessary for a patient to take when visiting the dentist and help us understand how to educate your dentist on your condition. Dr. Casagrande has practiced cosmetic and restorative dentistry for over 30 years in Los Angeles. He now lives in Tucson, Arizona. He then worked for Milestone Scientific, which was committed to advancing the science of computer-controlled drug delivery systems that offer significant efficiency and patient comfort gains for the medical and dentistry fields. He helped promote a dental device by traveling around the world to educate other dental professionals. Jean is unique because he's not only a dentist, but he is also an MG patient and therefore has a unique view from both the professional and patient angle. We do want to thank our sponsors today, our national presenting sponsors, Alexion, Argenix, and UCB, and also our national sponsors, Horizon and Janssen Neuroscience. I'm going to stop sharing my screen and we are going to let Dr. Casagrande share his screen and begin his presentation. Once we start the presentation, you're welcome to put questions in the Q&A box at the bottom, and we will ask those questions at the end of the presentation.
Thank you, Doma, for that nice introduction. And welcome, fellow myasthenics. Yes, I am a dentist and I am a patient with myasthenia gravis, so I think I have a little bit of information to share with you on the subjects of what to consider when you go to a dentist as a myasthenic patient. So let's see if we can share the screen and see here.
Perfect.
Yeah, I think
got it. Okay, I'm going to go on mute. And
can everybody see it?
yes, we can see it. It's perfect.
Okay, well,
looks great.
That's great. So again, Double will be taking any questions you have in the chat at the bottom of your screen, and then hopefully we'll have some questions that I can answer later. And then, of course, I'll give you some information. Even after this, I'll be available to answer any questions you may have. So, myasthenia gravis in dentistry. You know, dentistry is a part of a normal healthcare program and should not be avoided or feared by myasthenia gravis patients. Good dental health can prevent oral health problems, including gingival infections and decay, that can be more of an issue with MG patients than with other people. Oral infections and/or the stress of anticipating or undergoing dental treatment may precipitate or even worsen weakness or cause a myasthenic crisis. So controlled myasthenia gravis patients can tolerate dental treatment with modest accommodations, planning and cooperation by the dentist and/or dental hygienist and the dental staff. Uncontrolled myasthenic patients may need to be treated through hospital dentistry or special care programs in a larger health center. So it's very important to educate and inform. You must be educated about myasthenia gravis so that you can discuss the disease and your symptoms with the dental team, which includes the dentist, the dental hygienist, the dental assistant, and the receptionist. As a matter of fact, I just came back from having my teeth cleaned by a new dental hygienist. And I happened to mention, by the way, do you know anything about myasthenia gravis? She says, well, I remember something about that from, hygiene school, but to be honest, not really. So I spent the first 5 or 10 minutes explaining about myasthenia gravis and how you should accommodate patients that have this condition. So just be aware that most people, including the dental team, are not aware of this disease. So you have to be an educator. Since MG is so rare, expect that the dental team may not know that it's an autoimmune disease neuromuscular, and non-contagious disease that can have an adverse effect on your dental treatment. Inform the dental team about MG, your condition, your current treatment and medications, your symptoms, and your limitations, if any. So I think you want to tell them generally about, myasthenia and how you're doing, but also how you're doing that day, because as you know, some days we have better days than others. So if you're not having a really good day, that might be part of what you're going to tell your dental team. For more comprehensive information, access, print out, and then give to your dental provider MGFA's dental brochure. It's called Dental Treatment Considerations for the Dental Care Team, Dental Care and MG, frequent asked facts for your patients and providers. And you can find it at this website. This is the Myasthenia Gravis Foundation of America's website. And I want to stress that just noting MG or myasthenia gravis on a medical history form is really not enough, because they might read that medical history form and not pay any attention to the fact that you put down myasthenia gravis, because they may not know anything about it. So just noting MG on a medical history form is not enough. You have to inform and educate your dental team. How about dental appointments? Usually morning appointments are desirable, but this depends on when you are at your best. To avoid unnecessary stress, arrive to the office in time to allow little rest before the appointment. In hot weather, which we have here in Tucson, Arizona, and other parts of the country, I guess nowadays, it will help to arrive and be refreshed in the air-conditioned office before the scheduled appointment. Plan on being rested and unstressed to the extent possible before the appointment to lessen the chance of needing to cancel the appointment. Take all regular medications before your appointment. If taking Mesinon or pyridostigmine, take a pill at least 1 hour before the appointment for optimal orofacial and neck strength and to decrease the risk of myasthenic weakness or crisis during the dental session. Before stressful, extensive, or complicated procedures like multiple extractions or general anesthesia, discuss with your dentist and physician or neurologist whether there is a need to increase your steroid use or modify your medications before your appointment. If you're undergoing plasma exchange or plasmapheresis, and your protocol involves the use of anticoagulants or blood thinners, schedule your dental appointment for a non-exchange day in the treatment sequence. If taking immune suppressant drugs like Imuran, Cellcept, you may be more susceptible to infection. So ask to be seated to relax in a dental chair as soon as possible when you arrive to avoid sitting in a crowded waiting room. And today, I guess the COVID is making its comeback. So yes, you don't want to be in a crowded room with people sneezing and coughing and whatever. So avoid long dental appointments that can cause fatigue, especially in the muscles required to keep the mouth open. As you know, some of us have trouble, keeping our mouth open for a long period of time. If extensive dental treatment is required, ask the dentist to schedule multiple shorter appointments if possible. And don't be afraid to inform the dental team if you're fatigued and need to reschedule, even if it's in the middle of the treatment, because most dental procedures can be interrupted. And whatever the dentist is doing, it can be temporized and postponed to a later appointment. So don't be afraid in the middle of any treatment sequence or session, say, doctor or dental hygienist, I'm having trouble right now. I'm going to have to come back and finish my treatment at another appointment. Don't be afraid to do that. Amount of treatment, chair position, and head support is very important when there is difficulty in swallowing, holding your head up, breathing, or choking. So chair position should be a compromise between you and your dentist or dental hygienist. The chair should be reclined not only to where it's tolerable to you, but to where the dentist or hygienist needs it for access and visibility to permit proper and safe dental treatment. A small neck pillow can be useful to support your head, but most dental chairs have a contoured headrest for support. Now, there's some appointment A's that you should be aware of and know what these are for. A chairside assistant uses a high-speed oral evacuation suction tip like this. Okay, so that's to suction the water. If they're using a lot of water out of your mouth, make sure they know how to use this. And also a handheld self-directed saliva ejector are important and necessary to remove saliva and water, especially when a drill or a cavitron is being used. And that's this many dentists use. Put a little plastic tip on the end of this. Some people call this the sucking question mark. And yes, it's used to take water out of your mouth. And these are really important. A rubber dam may be needed to isolate the teeth and keep water and restorative material from getting near the throat, especially for restorative procedures. And that's what this looks like. You might have seen this before, but this isolates just the teeth that the dentists are working on. And the water is going to be suctioned from here, and it doesn't go into the back of your throat or your mouth. And especially if you have swallowing, this is very important. And if the dentist is going to do some restorative treatment and he's not using this, you might ask him to use it. Okay, because this is really important. Ask the dental team to use a rubber mouth prop to keep the mouth open if necessary. And that's what this looks like. And this helps you because they put it in and you don't have to strain to keep your mouth open. This is keeping your mouth open, and you can actually have the muscles in your jaw relax. Periodically, have it removed for a rest to the jaw muscles when it's appropriate. And be sure it's the correct size that does not excessively stretch the mouth and jaw muscles. Okay, so you find it where it's comfortable as far as the size. There are multiple different sizes the dentist can use. Okay, now let's talk about dental anesthetics and medications. Most dental injections use a traditional dental syringe like this. And they use the drugs Lidocaine or Articaine, which are normally safe to use. Okay, so don't be concerned about the medications or dental anesthetics that the dentist is usually using. These injections usually cause collateral numbness to lip, face, and tongue. So many of you have had dental treatment, and after the injection with this syringe, you feel maybe your lip or half your tongue is numb, or the side of your face is numb, your lips. This could be a problem, especially if you're having trouble swallowing and having some difficulty like that. Infiltrations on upper teeth are what's usually done by the dentist, and that's what this looks like. If he wants to numb this tooth, he's going to go up in this area, and he's going to inject in this area by the root of the tooth. But also, what's going to happen is your lip is going to be numb, and the side of your face is going to be numb. But now on lower teeth, we call these injections mandibular blocks. So the injection is going to be in this area behind the second molar or third molar if it's there. And this injection is going to numb all the teeth from the last tooth on the lower side all the way to the midline. So a lot of teeth. And also the tissue, gingival tissue, buccal and lingual on both sides of the teeth. But also it's going to numb half of your tongue. Half of your tongue will be completely numb. And your lower lip will be completely numb. Okay, so this is an injection that most dentists use for almost every lower tooth restoration or whatever they're going to be doing. One thing you must know that you don't want to ever let the dentist give you this injection on both sides of your mouth, because now your tongue is going to be completely numb. Your lower lip is going to be completely numb. So if he's going to do this, have him do it just on one side at a time. Okay. Now there is an alternative to this 165-year-old technology of the traditional dental syringe. It's a computer-controlled delivery system that allows a single tooth to be anesthetized comfortably and without numbness to the lips, face, or tongue. This is a 165-year-old technology. The instrument I'm talking about is called the wand. And what it is an instrument that produces a flow of anesthetic such that the anesthetic is going through a microtubing and then through the microtubing and through a little tiny needle held with something that kind of looks like a straw. So the dentist has excellent control of the needle, and he can actually put it on the tooth that he has to work on. It's called an interligamentary injection. But what he's going to do is just numb the tooth and all the tissue around that tooth with no collateral numbness to the patient's lip, face, or tongue. And as Dova mentioned in her introduction, after practicing in dentistry in Los Angeles for 30 years, I left private practice and came to work for the company called Milestone Scientific that makes this instrument. And for almost 25 years, I traveled around the world, over 55 countries, 100 and some dental schools, telling dentists about this technology. And so if you're going to have a lot of dentistry, restorative dentistry or whatever kind of dentistry done, you might want to ask your dentist if he has the wand or if he knows about the wand, and tell him about that there's maybe some other way that he can use a computer controlled delivery system for giving you the local anesthesia. It's very worthwhile as far as safety for myasthenic patients. So I just wanted to mention that. Now, when taking steroids like prednisone or immunosuppressive drugs like Imuron and Celsap, intraoral infections and delayed healing may occur. In case of a dental infection, the dentist should consult with your neurologist and or physician regarding the use of antibiotics and sedatives when necessary. Antibiotics such as penicillin and erythromycin are routinely prescribed in dentistry and can be used when needed. The one caution, of course, is the antibiotic ciprofloxacin. It's contraindicated for myasthenia gravis patients. And I've had a doctor prescribe this to me for, I think, bronchitis. Before I realized what was happening, I actually bought it from the pharmacist, and neither the pharmacist nor the doctor realized that it was contraindicated to people that have myasthenia gravis. So be careful. This is one you don't want to take. Avoid taking alcohol and or Valium to reduce anxiety before your appointment. Nitrous oxide with oxygen, which is called laughing gas, I guess, by many people. This is an analgesia that can be used for light sedation. But when major oral surgery or periodontal surgery is required, an intravenous sedation, or what they call twilight sleep, not quite general anesthesia, or general anesthesia, is necessary. The procedure should be completed by both the dental surgeon and an attending dentist anesthesiologist. Some dentists want to do the general anesthesia and the oral surgery, maybe taking out your teeth or doing implants or whatever, and do it at the same time. I think that since we have so many problems sometimes with our diaphragm, as far as breathing is concerned, I would suggest that, you ask the dentist, I need to have somebody doing the anesthesia and somebody doing the dentistry at the same time, and they'll find somebody that can do it. Respiratory support should be available if needed at all times. Now, remain in the chair until swallowing is under control and the saliva ejector is no longer needed. So don't just jump out of the chair right away. How about prevention? Brushing with a fluoride-containing toothpaste and flossing between the teeth is very important, even though it may be hard to do. But aids such as electronic toothbrushes, water picks, proxy brushes, floss holders, and mouthwashes are important to oral health for many myasthenia gravis patients. These are an array of electric toothbrushes. Now, I don't care which one you use. Some of them go round and some of them go back and forth. I think, though, that if you're having trouble as a myasthenic patient, these are very, very useful. They do all the job. All you do is move the toothbrush around. Also, this is very useful. This is a water pick. Not only does this an electric toothbrush, but it's also flushing water from this container through the brush, and it kind of flushes out some of the bacteria. Also, in between the teeth, it's very useful to use something that we call a proxy brush. And it comes in various holders. These are just nylon flutes that go in between the teeth. And that, helps take out the bacteria from in between the teeth. But of course, everybody will suggest you use flossing your teeth. And these are some floss holders that are very useful. So you don't have to just take the floss and then wrap around your fingers and try and get it here and there in the mouth. These floss holders are very, very useful. They used to make one that vibrates, and now they don't make it anymore. I don't know why. I gave it to many of my patients. It was great. Anyhow, those are aids that you really should consider. Now, see the dentist and the dental hygienist regularly and stay on a regular recall. Avoid dental emergencies that can not only be painful and stressful, but can also aggravate your myasthenia gravis and possibly cause a crisis. Take comfort in knowing that the dental team in these days uses what we call universal precautions, gloves, masks, and enhanced infection control measures. The best dentistry is prevention dentistry. Remember that. Now, great communication, of course, is very, very essential. It's essential. A good dental team patient relationship is absolutely necessary. If you don't have that, you're in the wrong place. Don't be afraid to discuss your MG condition and limitations with the dental team at each appointment, because they may have forgotten about it. And it's important for you to tell them, what limitations you may have as far as, your muscle weakness and what condition you're in on that particular day. It may be different the last time you saw the dental hygienist or dentist, but today may be a different day for you. Don't be afraid to discuss your current condition with your dental team. Don't be afraid to discuss your proposed dental treatment with the dental team and with your MG physician or neurologist, especially when you are unsure of how the treatment may have an influence on you and your condition. Don't be afraid to get a second opinion when needed. That's very, very important. Sometimes you think things aren't going well, and maybe you're thinking that the dentist is not paying attention to answering the questions you may have, or not being conducive to helping you with the situation you're in. Don't be afraid to get a second opinion. And don't be afraid to change to a dental office that is responsive to your uncommon needs and requirements when it's appropriate. But be your own advocate. You got to be ready to, be your own advocate and do what is necessary for what you think is necessary. I'd like to thank Dova and Meredith for inviting me to this wellness series presentation. And I'd be happy to answer any questions if we have them right now. So I'm going to stop sharing this.
We do have questions, Gene.
Do have questions.
So the first one that I have,
yes,
take my question in first. When you and I did a practice session, you had talked about not being afraid to take a break.
Yes.
Did you mention that today?
Yes.
But
yes.
I think that was really important, and something I kind of thought people should hear is that you shouldn't be afraid to say, I need to take a break.
Right in the middle of the treatment. Don't be afraid to say, listen, I'm having trouble right now keeping my mouth open. I'm tired, or whatever the situation is. My point is that the dentist can stop whatever he's doing, okay, in almost every instance, and temporize it and bring you back for another appointment. If he's doing crown or filling, whatever he's doing. We have the ability to temporize what we're doing and have the patient come back another time. So don't be afraid.
Perfect.
Say, I need a rest, or I need to come back for another appointment. Good point.
Thank you. So the first question we have is, MG patients need to be cautious when taking prednisone for a prolonged time, as it can result in bone loss. Should MG patients on prolonged prednisone therapy be concerned about their teeth?
Not so much about their teeth, but there is potentially loss of bone. I mean, there's some tests that they can test for, the density of the bone. But in general, it doesn't have an effect, let's say, if you have an extraction. But you should consult your neurologist if you have a question about that, especially if you're taking, like large doses of prednisone and you've been on it for a long time. Okay, normally when you first get diagnosed, they may put you on, 60 milligrams a day and then, wean it down to, for example, I take 5 milligrams every other day, a maintenance dose, which I know I'm going to be on for the rest of my life. Okay, so it really shouldn't have any effect. But if you're on 60 milligrams, you've been on it for a long time, and there's a question about the bone density, that may be something that you might want to consider talking to your dentist and your neurologist about. But typically, it has no effect on, in fact, it has a better effect on possible infections that might happen. Okay.
This next question is really a comment, but it's a good one. My hygienist allows me to hold the suction device so I can control the amount of saliva and water in my mouth, as it is difficult for me to swallow. I do remind them each time.
That's perfect. Yes, that's what I was trying to get at when I showed those different devices. And sometimes they'll let you hold the whole evacuation tip, or just like I said, the sucking question mark, that one. And you can move it to where you think water is, being, stored, and you can and relieve it there. And having that ability, I think, is great. And you know what? I think it's a great idea. And you can tell your hygienist or your dentist that that's what you want to do, and they should have no problem with that.
Right.
But also, I think if they're doing restorative dentistry where there's a lot of water, from the drill, that it's really important to make sure the dentist is using that rubber dam that I showed. That's really important, okay? Because then there won't be a buildup of any water to be concerned about.
And coincidentally, the next question is about the rubber dam. Are there dams or props that are not rubber? This person is allergic to latex.
They make rubber dams that are latex free. So again, tell your dentist, hygienist, whoever, the dental team, that you have a particular situation, and they should be able to, take care of that, situation for you. And if not, maybe you're not at the right place, because they do make rubber dams that are latex free. That's a great question.
Right. This person's asking, is it true a lot of dentists do not provide care to MG patients due to liability concerns?
I don't know that that's the truth. I think, that most dentists don't really know a lot about MG. So, unless you tell them, that you're really not under control, that you're really having trouble, and you're a refractive patient that has to possibly have intervention in emergency rooms all the time. You might want to tell the dentist that may not be equipped to handle that particular situation. But I think the most important thing is to tell the dentist what your situation is, and would he be able to handle that situation if there was an emergency?
Right.
And I think most dentists would probably say yes. Some may not, and then maybe you should find a dentist that would be more responsive to your needs.
Right.
Yes.
The next question is I'm allergic to penicillin. So what can I take, and how do I find it in my area? Okay, let me read. Sorry, I read it wrong. I'm allergic to penicillin. So what can I take, and how can I find dentists in my area that deal with MG patients?
Well, I think that, most dentists, as long as you inform them about MG, wouldn't have a problem treating you. I mean, it's just a condition that is easily, treated and can be brought under control for the most part. And like I say, if you're really a refractive patient, and some of us are, that are really having a lot of trouble, then that's something that you should talk to your dentist about. There are specialists dentists that are trained to take care of patients like ALS patients, like, all sorts of conditions that are not normal. And there's dentists that are trained. Sometimes they go through an actual year or two after dental school to be able to train, patients that are either myasthenic or have other conditions that are not normal. But I would say, as long as you make them aware of your condition, I should, and they're willing to compromise on a lot of issues like the chair going back. You know what I'm saying? I mean, you can't have the chair going straight up and down, then the dentist can't really see what he's doing. So that's not good for you either. So as long as the dental team is willing to compromise and understand your condition and work with you to accommodate, whatever needs you have, I don't think there's a problem. I think the main thing is to not only put MG or myasthenia gravis on a medical history, because most medical histories don't list that. Okay, you could go to a dental office, you go to a physician's office. They don't list myasthenia gravis. We're a rare bunch of people, our club, the myasthenia club, okay? So it may not be something that's, thing that you check off. Oh, I don't have this, I don't have that. So you may have to add that and then circle it, put a check behind it, and then not only do that, but explain the condition you have with your dental team. Okay, that's the main thing.
There's the next two questions are actually similar, so I'm going to kind of combine them. But people are asking, so I'm looking for a new dentist. What questions do I ask when I call? And how do I, like, when I make an appointment, am I making an appointment just to talk to them? Can I make an appointment to have a cleaning? What's the best way to go about, meeting the team and having them understand me? And what, as an MG patient, should I be asking them when I'm interviewing, so to speak, a new office?
That's an excellent question. And I think in the case that you talk about, if you're an MG patient, you're concerned, most dentists will be able to handle your situation. If you're really concerned, you need to talk to them about having a consultation appointment. Okay. And this is not where you're going to have any treatment. This is where you're going to have an oral exam. They may take x-rays, no big deal about that. And then you have the ability to talk to the staff, talk to the dental team, let them know your particular situation. And are you going to be able to, accommodate me? Do you have the proper equipment? The point is that as long as you let them know what your situation is, I think most dentists will be accommodating. Today, we have plenty of new equipment. We're not back in the old days. And most dentists are well trained to take care of most situations. As a matter of fact, I probably took care of myasthenic patients without even knowing it. Okay, because they didn't put anything down on their medical history. Okay, so the idea is that as long as I think it's maybe not a bad idea to have say I'd like to have a consultation appointment. Now, there are a lot of patients that when I left practice, of course, some of my patients have been with me for many, many years, and they wanted to find a new dentist. Okay, so I could refer them to a new dentist. Some people leave, dentist retires, or they move to a different town or location, and you're looking for a new dentist. My point is, when you go into that dental office, from the time you're meeting with the receptionist and the dental assistant, the hygienist, the doctor, if he's going to spend time with you. In other words, during that first consultation appointment, if you feel like you're not in the right place, get up and walk out. I tell patients, if you feel like you're not in the right place and the dentist isn't explaining things to you, is not accommodating you if you have certain needs, then I don't care if he's in the middle of something. You say, I don't feel well, just get up and get out. Just go and find a place where you're comfortable. Women's intuition, we always talk about, it really does make a difference. And men have intuition also. So when you go to a new office and for some reason you feel like you're not in the right place, then you're probably not in the right place. And there are plenty of places that you can go and find maybe a dentist that your friend has been to and that they're happy with. So yeah, I think it's not a bad idea to have a consultation. And then you get an idea about what this guy or girl is all about.
Right.
I mean, I say guy and girl because I have a granddaughter graduating next year from dental school.
Thank you. The next question, and I'm not sure if it's for you or really for the person's neurologist, but I have a hip and knee implant, and it's recommended to take amoxicillin prior to appointments.
Yes.
I've been told that amoxicillin can affect my MG meds.
Yes.
How do I handle that?
Okay, they have changed. I mean, in the old days, we would give it amoxicillin for that, any replacement. And I think they have changed the antibiotic precaution for that now. And so I think that amoxicillin, if you're not allergic to penicillin, is fine. And now I think they give it to you maybe a couple hours before the appointment or something like that. And you just take it one time. We used to have, you take so much one day and then for another week, you take a bunch in the old days. So now it's very simple. And as a matter of fact, I think there's some points that if it's like after 6 months or a year after you've had the replacement, you don't have to take anything. I've had 2 shoulders, 2 knees, and a hip. I don't take amoxicillin or anything as a precaution. So just talk to your doctor, ask him, and what is the latest? Just ask what is the latest regimen. And if it's amoxicillin, usually it's taken that day before, or I'm sorry, that day of the appointment.
Perfect. There's a few questions in the Q&A about implants.
Yes.
And how they should be handled. So I'm not going to read every one of them, but
yes.
in general, what do people need to know about dental implants and getting them, with MG? It's obviously a longer procedure, but what do they need to know?
Implants today are the extraction is one thing, and then sometimes you have to wait and let the bone heal. Sometimes they have bone grafts that they put in at that point. You might have to wait. And sometimes, depending on the situation, they can put in the implant that same day. Okay. To put in an implant in today's implant dentistry, it takes probably 20 minutes. So it's not a big involved thing, really. It does involve the anesthesia. And so, if they had the wand, you basically just anesthetize the area where the implant is going to be placed instead of, your whole face and tongue and lips all anesthetized with collateral anesthesia. So, that is, another important thing that you might want to ask your dentist about.
Do you have any idea what percentage of dentists, like in the United States, have the wand or using it?
Well, it's about, I think, to be honest with you, it's more accepted around the world than it is in the United States.
Really?
It's not expensive. It costs like less than $3,000, and it costs like maybe $4 for each use. So it's not expensive, but some dentists, unfortunately, don't want to change. They're kind of, set in their ways. They learn one thing and that's what they're going to do till they retire. And others accept it. So probably I would say 10, 11, 12% of the dentists in the United States have it. But when you go to the Middle East, for example, or even Asia, China, they have it all. It's well accepted.
Yeah. Okay, the next question is, do you have an opinion about immunosuppressive drugs like methotrexate and the buildup of plaque?
I don't know if there's any studies that have been done on that. I mean, I'm one of these guys that, show me the studies. Somebody just, my cynic just talked to me yesterday, actually, and he was asking about, what do you recommend as far as dietary supplements or, anything that's that we should be taking, that's not, of the normal. And I said, well, I don't know. People anecdotally say this helps and that helps, and Indian turmeric and this and that. But I'm one of these people that wants to see the scientific evidence that something works. And I don't hear that there's any issues with that, as far as dentistry is concerned. Build up a plaque, I don't think it matters. Just go regularly. If you build up plaque a lot more than normal, then maybe you have to see your dentist or hygienist every 3 months, not every 6 months.
So there's a question that asks, how often do you recommend teeth cleaning? So it kind of depends on.
Well, it depends
the
on the
situation.
situation. I mean, some people with periodontal disease or periodontal conditions should be seen every 3 months. Typically, every 6 months, twice a year is what typically a normal healthy patient without major periodontal problems should be going into the dentist at least every 6 months.
Someone's asking about using a dental dam for a cleaning.
Dental what, ma'am? Dental
The
what?
dental dam for the cleaning. For a cleaning.
No, the dental dam is not really used for the cleaning because it isolates the teeth that you have to be working on. So it's
Right.
used mostly for restorative dentistry and not necessarily for, cleaning or periodontal surgery or anything to do with the gingival tissue, the gums.
There's also a couple people asking about penicillin, being allergic to penicillin. So what regimen do they
Well,
use?
basically, if you're allergic to penicillin, the next treatment down the line is erythromycin. Okay, so that, when my patients were allergic to penicillin, erythromycin is the one I would prescribe. There are other ones also, but that's the main one.
Got it. So I have a couple more questions. Someone's asking, is it advisable to see a well-regarded dentist who is the only person in the office? I am fearful in case of emergency that there's no one else to help.
I mean, the dentist is the only one, not even anybody else.
That's what the person's saying.
I don't know that I don't know about that, because if there was an emergency, somebody has to call 911, somebody has to get the oxygen. That's another point. Make sure that whoever dentist you go to has oxygen ready, okay? And make sure that the tank is full. They may have an oxygen tank that's not full. Okay, so I think that's really important. And, it's a law in many states, but many states not. And I used to be on the state dental board in California, and I used to be auditing dentist offices. That's one thing I look for. I look for sterility. In other words, they have to have, a sterilizer that works. Okay, and also they should test the sterilizer every week to make sure it's working properly. There's a test that you use to make sure it's working properly. So things like that are just precautions that most patients don't know about, but you should surely ask. When you go to a new dentist, those are good questions to ask. Do you have oxygen ready here? And I'd be a little concerned if I went to a dentist that had nobody else in the office. I think that's very, very few people. Today you really need, at least somebody else in case of an emergency, especially.
Yeah. Someone's asking about it. What about having a full mouth implants? If that's something, if there's any special precautions for MG patients.
Well, of course, if you're going to do full mouth implants, especially on the lower, you're going to probably wind up with 4 implants, 2 on each side. And so when they do that, they're going to either put you out all the way and anesthetize the areas. And typically they're going to anesthetize the areas using the mandibular block I showed you, which is going to numb half your jaw and your lip, full lip, because you're doing it on both sides. Instead, they should just be able to anesthetize directly into the area where the implant is going to be placed in 4 different sites, especially with this instrument I was showing you, which goes in like an IV drip. So number one, you can't feel it. And number 2, it spreads out and it's localized. just to the area you're going to work on. So if you know, they might want to ask if they have that kind of an instrument available, or what's going to be, you know, the situation, especially if you're having trouble swallowing and whatever, especially with bilateral block, okay, on 4 lower implants. On the upper, it doesn't matter. That's a different story. But especially on the lower, I'd be concerned, and make sure that, you know, that they have somebody there to help out if there's an emergency. Okay. But remember, when you get that, all 4, your whole lower lip is going to be numb, and your whole tongue is going to be numb with their traditional ways that they're doing it.
Perfect. Well, Jean, thank you so much for all of your time and all of your great answers to the questions. Everyone, it is being recorded, and it will be up on our website shortly. And if you have any other questions, I know Jean is available. You can
You know what? Let me. I think I had a slide. Maybe I.
You can put your email in the chat.
Hold on a second. Let me see if I can find it in the slide here. There was one more slide that I missed. Let's see here.
Absolutely.
There it is.
Perfect.
Questions. We just did questions, but here's my email, because I, for the last 10 years, have been the leader of the Myasthenia Gravis support group in Tucson, Arizona, and in Arizona we have people from Phoenix also. So this is my email. I'd be happy to answer any questions that anybody would have. Just email me, and I'd be happy to work with you and answer any questions you may have.
All right, Jean. This
there was a thing we missed.
I don't think so, but this has been fantastic, and I think there's a lot of useful information for people. Very practical, useful information. So
I hope so. And
I know that people are happy to hear you, and they'll also be watching the video of the webinar afterwards. So we appreciate your time, and we will talk to everyone soon.
Okay. Stay
Thank
well.
you very much. Bye-bye.
Bye-bye now.